my name's Louise. I'm a Consultant Midwife Trainee in Thames Valley. So currently I'm rotating around different hospital trusts, greatly in sympathy with the trainee doctors who do the same. And I'm currently on a year-long placement as a Consultant Midwife Trainee in Buckinghamshire Healthcare Trust, which is where I've done quite a lot of the work that I'll be talking about in terms of identifying and providing support for women with fear of birth. My doctoral study, which I'm doing as part of my consultant midwife training, is also on fear of birth, and I'll be talking very briefly about that. But overall, just to say that my doctoral research topic is whether actually we can provide better support for women with tocophobia if they're supported psychologically and emotionally with support from doulas throughout their pregnancy. So that's a little bit of where I've come from and my interest in this subject. So let's get going, and I just want to start off with some really sort of basic introduction to fear of birth, the prevalence, and what the impact really is and why it's so significant for us as midwives at the moment. So moving on to the first slide. So what we think in terms of fear of birth nationally, about 10 to 20% of women with uncomplicated pregnancies experience significant fear relating to birth. Now that's not a statistic that's taken directly from the UK. A lot of the fear of birth research, as you'll see from some of the references that I've got later on at the end of the presentation, actually come from Swedish research and Australian research, and there's a lot going around in the Nordic countries as well. But what we're trying to do is work out what in the UK is the current prevalence, and we think probably around 10 to 20%, but growing, and I think that's something that all of us as we work clinically see day in, day out. And why we're particularly concerned is for the 6 to 10% of these women where the fear that they have of birth is so severe that it really negatively impacts the woman's experience of pregnancy, and it becomes incapacitating and really impacts what she can do and how she manages that anxiety on a day-to-day level. So there is a lot of research out there on why women are afraid, and that's worth quickly digging into. So really we can divide it down into two main reasons. So the major foci for fear of birth are firstly physical reasons, and these are the sort of slightly more predictable ones. These are women who are really fearful about labour pain, loss of their life or loss of their baby's life is a major factor, and real fear about obstetric injury. And I think, as always for these things, as birth becomes less connected with the communities, as women birth less at home, actually what we're finding is that women's understanding of birth is much less, and we think this is one of the reasons why women fear the physical reasons more. But I think almost a more impacting reason, and something that's really driving a lot of the research at the moment, is that for many women their fears are rooted in the psychological element of the childbirth experience. And so I think this is key in the way that we go about managing and supporting women in their care, because actually it's not so much about what happens at labour, it's how they feel. And so two of the key reasons that come out in the qualitative research are around women feeling a loss of control, and also women feeling like they have insufficient support from their carers in labour. And whether that's what we refer to as primary fear of birth, which is women in their first pregnancies who've not given birth before, or women who've had a previous negative experience where they weren't necessarily anxious beforehand, but in their second, third, subsequent pregnancies, they are feeling that because of that previous traumatic birth, that they're fearful. And those two things, loss of control and insufficient support from carers, seem to be two major psychological elements of women's fear. So I think what's really important to look at is who is most at risk of fear of birth. Who are the women who really are vulnerable to suffering with this? And there are two key categories of women who are high in the prevalence of significant tocophobia and fear of birth. And one is there's a strong association between women with previous mental health problems who go on and develop fear of birth in pregnancy. And the second one is women with certain personal characteristics, and this is something that's come out in quite a lot of the research, that there are three sort of key elements of things that are going on in women's own lives that put them at added risk of that trigger of preparing for birth really brings out anxiety and fear for them. The first is dissatisfaction with their partnership, and that's a really difficult one for us as midwives to know how to handle. It does appear to be a theme that comes out in various parts of the literature, that women who are in relationships that they don't feel so secure in, and this is probably linked in with women's lack of support. So women who don't have good emotional and family or friend support, or support from healthcare providers around them, they are particularly at risk of suffering morbidity, psychological morbidity from fear of birth. And the other one is low self-esteem, and that's something that comes out in the research as well. And so quite a busy slide here, but I just wanted to summarise what the impact of fear of birth is and why it's important. And I think it's important that it's not just the effect that it has in labour or the effect that it has antenatally, but looking at the whole of the pregnancy and seeing how this is affecting women. So antenatally, the thing that is coming out more and more, and the real focus of the some of the agenda of that driver to improve our perinatal mental health provision in the UK, is that antenatally there is a long-term impact of untreated maternal mental poor maternal mental health, and particularly in terms of untreated maternal antenatal anxiety. So again, this fits in for women who have significant fear of birth. Actually, the increased cortisol levels that their babies are exposed to in pregnancy have a detrimental psychological and neurodevelopmental effect on the woman's baby into adulthood. And I've put a couple of references there that actually, if you do even a really brief literature search on the impact of antenatal anxiety, antenatal tocophobia, on the impact on the fetus, there is a significant long-term impact both into childhood and then through to adulthood as well. And the emerging literature on that is really significant and a real driver for us to consider how important this is. Now, we also know that in labour, for women who are significantly fearful, actually this is going to have a knock-on impact on how they labour. We know that women with significant fear of birth experience greater pain during labour, they have greater epidural use, they have prolonged labours, and there's an association with a greater use of instrumental birth and instrumental delivery. So those are some of the impacts in labour. What there is a lot of discussion about is whether there's evidence as to whether fear of birth is associated with a greater likelihood of having an unplanned caesarean section. So for the women who are really fearful, we know that they are more likely to end up with an instrumental delivery. Actually, the studies that are out there on whether this has an impact on whether they're more likely to end up with an emergency caesarean section in labour is really mixed. Some studies say yes, some studies say no. So I think we conclude that we really don't know, but because of the sequelae of the other things that are likely to happen in labour when women are really fearful, these might be the associating factors. Now, postnatally, this isn't something that for women is just ends when the baby's born. We know that women who've suffered with high levels of antenatal anxiety are at an increased likelihood of suffering from postnatal depression and anxiety, and they're also likely to report a greater dissatisfaction with the birth experience, even if they don't experience any of the complications that we've talked about already. So I guess one of the big questions for us all is elective caesarean section the answer? And I think my overall assessment will be no, absolutely not for all. And I think one of the things that really comes out when we look at the literature is that women's experience of elective caesarean section can lead to the same feelings of lack of self-efficacy and loss of control. So if we were to, as women report fearing when they have a vaginal birth, so if we look back at some of the things that women are afraid of and it comes to lack of support, loss of control, loss of privacy, dignity, actually those are things that are potential concerns with women experiencing caesarean section as well. So actually it's about digging down to the root of what the woman is actually fearful of. However, for some women, it really is fear of the vaginal birth itself. And for those women, it may be the right choice. I'm sure that some of you are familiar with the Montgomery Lanarkshire ruling, which I won't go into in huge detail now, but it's really worth looking at in terms of how we are consenting women and how we view physical risks versus psychological risks to women, and what it is for women that they consider most important. Because for some women, the physical risks of caesarean section are well outweighed by the psychological risk and the emotional risk that they feel that they'll be put at going through vaginal birth. However, what we really need to identify is which women are which. Which are the women who actually the underlying psychological concerns that they have are not going to be solved by elective caesarean section, and which women actually this is the way of preventing greater psychological morbidity. So it really boils down to two things when we talk about how do we support women with fear of birth. And I think there are two things that are particularly important for us as midwives. One is that we identify women early, and two is that the women who are identified as having tocophobia, who have significant fear of birth, have a really good continuity of support all the way through pregnancy. So I'm going to just draw out those two things now. So at this point, it's just worth having a little reflect as to what the situation is at your trust. What are the pathways for women who come forward and say that they are fearful of birth, and what other processes and care available for them? So I'm just going to talk a little bit about our experience and what we've been doing at Buckinghamshire Healthcare Trust. And so one of the things that we knew was from the literature, we knew that it was clear that women with significant fear of birth, they need psychological support throughout pregnancy to minimise the negative impact of antenatal anxiety on them and on their babies. And what we found was that for most women, they were being referred through the consultant midwife for supportive birth planning. However, we found that these women were not being identified for referral to us as consultant midwives until really late into pregnancy. So what we did was we actually looked at we did an audit of all the referrals to the consultant midwife, and in this trust we have consultant midwives as well as supervisors of midwives. I'm a supervisor of midwives as well. In some trusts you won't have a consultant midwife, but you may have supervisors of midwives for whom these women are referred. And so what we did is we undertook an audit of all the referrals to the consultant midwife to see when the referrals were happening. How early in pregnancy were we finding out that women were really fearful? And what we found was what we found backed up our feeling from clinical practice, which was actually it was all coming very, very late. So 42% of referrals for women who said they had significant fear about birth occurred after 34 weeks. And this was a huge problem. And what it told us was that actually what we were dealing with was women who were significantly fearful, who had too little time for professional psychological support and therapies, too little time to build therapeutic relationships with their midwives, with a multidisciplinary team, and too little time for effective supportive birth planning. So it was so common to have a woman come referred at 36, 37 weeks, because that was the first time she had really felt she had the confidence to say to her midwife, maybe at 36 weeks when they were talking about thinking about birth planning, actually I'm terrified about birth and I really need an elective caesarean section. So actually you've only got a couple of weeks to play with to really make sure that this is a choice that the woman is making with the fullest available support that she can have. And so what we found was that often, because we didn't have time to work with women over a number of weeks and months, that women who were feeling like elective caesarean section was the only option, because we didn't have time to put in the groundwork to provide CBT, to provide a number of months of planning for alternative methods of and modes of birth. And so what we did was and this is something that we have very recently introduced, we have started screening women for fear of birth at 16 weeks. So every woman is asked at 16 weeks to fill out a small form that says, how do you feel about birth at this moment? And what we hoped was it would give women an early opportunity, the women who otherwise wouldn't pipe up and say, you know what, this is what I'm fearful about. We wanted and could give an early opportunity to really boldly ask the question. And what we would then do is that if women answered positively that they had real significant fear of birth, that they could be referred into psychological therapies available locally for at least 16 weeks before their due date. And we really hope that this extra time will make a real impact into women's experience of pregnancy and overall as well potentially into their birth choices as well. To give a really brief background to the tool that we introduced, someone else had done the hard work for us. So this was a tool that was introduced by an Australian researcher who wanted to develop a simple tool that could be utilised both in research and clinical settings to find out how strong a woman's fear of birth was. And this is just a quick screenshot of the tool. It's really quite simple. It's a tool that the woman fills out herself, and the referral information is all on the back, but at the front it's just a two-prong visual analog scale where the woman just puts a cross somewhere on the tool as to whereabouts she feels that she is on the scale right now. That is then measured. It's exactly 10 centimetres long. That's measured, and depending on where the crosses go on the visual analog scale, that is calculated into a score, and there's a cut-off score for women to be referred to. And so looking at the early impact of this, I mean, we are only 8 weeks in, so I don't feel like we're in a really brilliant place to talk about what the long-term outcomes of this are going to be, because really we need a whole of a woman's pregnancy to really begin to collecting good data. We're finding on average we've got about 1 referral a week, and we're getting some false positives as well, but we've got really positive feedback from women and positive feedback from midwives about having a really clear way of simply opening discussion about women's emotions around birth. And then it's also meant that we've got a really clear multidisciplinary pathway if women disclose fear, and I think that's one of the struggles that midwives have, is when women disclose fear of birth, there's not necessarily a clear pathway for them to be helped into. And so just very briefly, I'm just going to finish just talking about the impact of fear of birth on the midwife-woman relationship, because this is what we live and work with day in, day out. I think there's a really key paper that shows that actually it's a real challenge for midwives caring for women with fear of birth. And actually it's really important to acknowledge the impact that this has on midwives as well. There are a few little quotations from this qualitative study of midwives' experience of caring for women with fear of birth, where midwives feeling stress at not knowing what her actions could cause. What if a woman is really fearful about birth? It's almost like midwives are feeling like they're on tenterhooks and treading on eggshells, not wanting to do further psychological damage to the woman they're caring for. I think sometimes one of the things that came out in the research was that women who were trying to gain control over the birth experience and over the fear, were trying to maintain control through complex and detailed birth planning. And there's lots more research out there about birth planning, and we're not going to go into that now, but one of the quotes from a midwife was that it can stress you and make you feel inadequate. And another midwife used really strong language and said she felt provoked and almost angered by the degree to which a woman was totally coloured by her fear. And so the key thing for this, when the take-home message, is that actually caring for women with fear of birth is complex, because actually a woman's fear not only colours how she thinks of the birth herself, but can impact on that midwife-woman relationship and our ability to provide really good therapeutic care. And so the key thing is to really seek good support from consultant midwives, obstetricians, perinatal mental health services, and supervisors and midwives for women, but also for us as midwives. And I think I also just want to say that there are huge rewards for working with women who are truly fearful about birth. We've seen that there are huge benefits of continuity of support and continuity of care for women who have fear of birth, and there are a few really good studies out there that show that continuity of support for women with fear of birth really improve their psychological outcomes. So I guess this is a question of whether caseload midwifery for psychologically vulnerable women with fear of birth is a model that we need to look to introduce. And we're also looking at alternative models, and that's one of the reasons why I'm looking at doulas in my PhD research. There is a smaller, there's some small themes that have emerged in the literature that I've looked at that suggest that actually having continuity of emotional and psychological support from someone who is not a clinician is important for women, full stop. And we know that there's loads of good research out there on the impact of doula support for outcomes in pregnancy. But what there isn't any research out there at the moment is whether what the benefits of doula support might be for women who are emotionally vulnerable, for women with psychological morbidities and fear of birth. So this is what we're looking at, and we are undertaking the research within the next year. And it will be a qualitative research study looking at the experiences of 8 women with tocophobia who've been supported through NHS-funded doulas throughout their pregnancies. And we want to see what the impact is on their experience of pregnancy and also their birth outcomes. So that's hopefully something that is in the woodwork, and I'll hopefully give me a couple of years and I'll be able to tell you a little bit more about what I found with that. But I think the real take-home message is that actually as midwives, every opportunity we can counter and we can be the solution to women's biggest reason for fear of birth. And the thing that comes out time and time again is that women are afraid of not being understood, they're afraid of not being listened to, and they're afraid of not being supported. And as midwives, we have the privilege of being part of the solution to that as we work together with the multidisciplinary team.